I'm Brittany Lewis with Forbes Breaking News. Senator Tim Scott led a Senate Aging Committee hearing about a mental health crisis facing senior citizens. He highlighted some sources of the crisis, such as economic challenges, COVID, crime, and loneliness. Scott quoted Surgeon General Vivek Murthy, who said loneliness is like smoking 15 cigarettes a day. Listen in to the South Carolina Republicans' full opening remarks.
To the guests, panelists, thank you so much for participating in this process. It's without question, your expertise will lend itself to us uncovering more solutions and providing more assistance to those who are certainly in need of that assistance. I'd also like to take the time to recognize the students behind the witnesses, the University of South Carolina's pharmacy students who are part of the Walker Scholars Program. They have decided to join us for the next 3 or 4 hours. I appreciate y'all sticking around for the entire time. That was my joke, and no one thought it was funny. But the good news is it wasn't that funny. But the truth is I am always happy to see folks in the room from my home state, and thank you so much for taking your time and investing a part of it in this important topic. And without any question, as the students are here with us, it really is important for us, Chairman Casey, to stress the importance of the Mental Health Awareness Act that we have both sponsored. The truth is that too many of our seniors and frankly our general population continue to feel this heavy weight on their shoulders, and it is one that is palpable. I think it's true at all ages. There's no doubt that the suicide rate amongst our youngest Americans is way too high, and the same is true with our seniors. I was talking to someone recently, just yesterday, and we were walking through on one of my constituent calls the rising crime and the officers that have been shot at a record level and the highest number of incidents focusing and targeting our officers and, frankly, the nation's history. We watched in Buffalo another racist attack. You go to the gas pump in South Carolina, the gas price has doubled in less than 2 years. The fact of the matter is, if you're involved in an accident, which actually happened to the constituent's son yesterday, there are no rental cars. Parents who are looking for formula can't find it. There are reasons why Americans feel a level of burden and stress and challenges. It's the fact that economically, crime, safety, security, loneliness, I think it was Surgeon General Murthy who said that loneliness is like smoking 15 cigarettes a day. And just thinking about that is a lot for the average person coming out of a pandemic, and the lingering effect is undeniable. That's why I'm so thankful that Chairman Casey and I have worked diligently in a bipartisan fashion. There are many Americans who think nothing in Congress ever happens with the two sides coming together. Simply false. The truth is, all that we accomplish in the United States Senate requires a bipartisan coalition, and that is a blessing to the great United States of America. One of those is the AIM Act that Senator Casey has already described. Another one that I'm working on is the Academic Act. It authorizes a comprehensive study of the long-term impact of COVID-19 and associated school closures, especially on children from low-income families. This bill is sponsored by Senator Rubio, Chairman Casey, and myself. Substance abuse, of course, and overdose deaths are skyrocketing as a result of the mental health crisis that we've seen for the first time. Overdoses have exceeded 100,000 in America, around 107,000, more than car accidents for the first time. The lifetime odds of dying from opioid overdose are now higher than those car accidents. To tackle opioid misuse and raise awareness, South Carolina launched a campaign called Just Plain Killers, particularly among the aging population who prescribed opioids for chronic pain. In addition to the substance abuse, many seniors were plagued, as Senator Casey said, with loneliness. And I will do my best not to reiterate what he has said unless it's just necessary. Sometimes it's necessary to emphasize or reemphasize the importance of the challenges that so many of our seniors face. Also, in addition to that, I mentioned the deaths of our law enforcement officers, and the worst situation for those officers is to go to a domestic situation. It's one of the reasons why in Richland County, law enforcement officers received over 2,700 calls just in a year related to mental health crisis. Not a crime, but a crisis. So we have legislation that focuses on the importance of co-responders so that you actually have officers and mental health experts going to the scene so that we can address the issues in the home without making it necessarily a crime. These are some of the topics that we will discuss and some of the important issues that we will have to face as a bipartisan coalition of people who believe in the future of America, and we are going to get it done. Thank you all for being experts and providing your expertise with us today.
Thank you, Ranking Member Scott. I'll next turn to witness introductions. I'll do several, and Ranking Member Scott, I know, will do one of our introductions. Our first witness is Dr. Erin Emery Tiburcio. Dr. Emery Tiburcio is an associate professor of geriatric and rehabilitation psychology and co-director of the Center for Excellence in Behavioral Health Disparities in Aging at Rush University Medical Center. She has a PhD in clinical psychology and completed her fellowship in clinical geropsychology. Thank you, Doctor, for being here with us today and sharing your expertise with the committee. And we'll turn next to Ranking Member Scott.
Thank you, Chairman Casey. It's my honor to introduce to all Dr. Ken Rogers. He helps South Carolinians navigate the mental health system as the director of the South Carolina Department of Mental Health. The department operates 16 community-based outpatient mental health centers, clinics across all 46 counties, and 3 hospitals, including one for addiction treatment. A long history of working to expand mental health services to underserved populations. He collaborates with traditional and non-traditional partners, including law enforcement. He is a native of the area called Dillon, South Carolina, and a graduate of the University of South Carolina School of Medicine. He completed his general psychiatry residency and a child and adolescent psychiatry fellowship at the William S. Hall Psychiatric Institute at the University of South Carolina. He earned a Master's of Science in Public Health from the University of California in Los Angeles. He is bicoastal. He holds a Master's in Medical Management from the University of Southern California. Prior to coming back to South Carolina, he was the Chief of Psychiatry at Parkland Health and Hospital Corporation in Dallas, Texas. In his testimony, Dr. Rogers will talk about his department's work in providing mental health services and the pandemic's impact on mental health, especially for caregivers and our veterans. We look forward to hearing your testimony, and we thank you sincerely for being here.
Thank you, Ranking Member Scott. Our third witness is Kimberly Williams. Ms. Williams is President and CEO of Vibrant Emotional Health. She has overseen the expansion of Vibrant's community